This is Tom Salemi. We're here at the conclusion of our inaugural Aesthetics Innovation Summit. Grateful to be joined by one of our great co-chairs, Grant Stevens. Grant, thanks for joining us.
Thank you very much for having me.
So let's get your assessment of the day. I mean, you had a lot of great startups and conversations. What was your sense of the entire day?
This has been an unbelievable day. It's a landmark day. The best and the brightest, the movers and the shakers, were all here. This is the aesthetic industry's leading experts from industry, from finance, and from clinicians like myself. I am so impressed by the quality of the presentations and the people who attended. You know, we had almost 300 people here and they stayed to the bitter end. I put on a lot of meetings before. It's so impressive to me that the audience stayed and right on through the whole thing. It speaks to the quality of the presentations.
What does this say to you as a plastic surgeon, just to have a day dedicated to these many treatments that can someday find its way into your office? Is it exciting to see so many things coming down the pike?
Well, certainly it's exciting for me to see many things coming down the pike. However, most of what we saw here today is already out. Mm-hmm. We had some new technologies coming out, but we finally had all of industry in any given area we're talking about, from women's health to rejuvenation and so forth. We had the industry experts, some of whom are already there, like for instance the toxin panels. Mm-hmm. We had the 3 largest toxin providers, and then we had 2 that are before the FDA shortly, trying to become FDA approved and so forth. I think it's really great for the clinicians to see what's coming down the pipe. But I think even bigger than that was to get industry together and to talk amongst themselves about what they're providing for the entire environment, the whole ecosystem of aesthetics.
Well, what is the relationship between industry and your specialty? We see these events work well when physicians are open to discussing with industry what they need and even perhaps generating some ideas of their own.
Well, as the past chairman of the industry exhibits and industry relations of the Aesthetic Society, which is the American Society for Aesthetic Plastic Surgery, I am very close to industry in that I believe industry is the way we provide new goods and services and products to our patients. So while some physicians are uncomfortable with relations with industry, I think they're ignoring the fact that without innovation, without capital, without investment, without industry, we're stagnant, and we can't go on and provide our patients improved services, improved quality of life. Industry and plastic surgeons are partners, and I feel that events like this and events like Hot Topics at the aesthetics meeting that's going to start here in New York day after tomorrow, those are very important. That's how we work together as partners. Think about how many things we heard about today, in fact, started in physicians' offices or in the brain of a doctor, either an MD or a PhD. A lot of this stuff started in garages, and then industry partnered up with the inventors or the idea, the technology, and then with years and years of research and hundreds of millions of dollars overall spent to prove the safety and the efficacy, we now have these products and these services. And I think oftentimes physicians do not think about how much is at risk, mm-hmm. and how much capital needs to be expended in order to go to the FDA and go around the world and actually prove safety and efficacy.
So do you think this was an opportunity for them to interact with, say, the venture capitalists who they might not have been connected with before? We had the VC panel.
Yes, absolutely. That was actually the most unique thing in terms of the physician experience. I think there are very few physicians who interact with the VC people and the financial people, you know, the Drews and all the rest of the guys that were here. So it's a great opportunity.
And going forward, we had Steve McMillan from Hologic presenting perhaps definitely a new mover in the space. Mm-hmm. How does that make you feel as a physician in the space? Is it nice to see some larger players complement the Allergans and the others who are already there?
I'm very excited, and to have J&J here and to have the new people on the block, mm-hmm. We love it. The more the better, and there's more capital and more commitment to growing this aesthetic space. And we're very happy about that.
It really seems like we're just seeing a culmination of forces of financing, of innovation, and of buyers coming into this area.
Yes, absolutely. And as the last panel was just talking about, the boomers are here consuming this. They're all candidates for all this, but obviously the Gen X and the millennials, but the boomers are all there, and they're living longer. They want to look better. They don't want to go down the way their parents did, and so the market size is gigantic, and it's great to see the venture people here recognizing that also from their perspective.
But you mentioned the millennials, and they got a lot of credit for changing the way business may be done with like a Hint MD or something.
Absolutely, and next year the millennials will be spending more than half of the money on this. And you mentioned Hint MD. There's no question Hint MD has changed already this approach to consuming aesthetic medicine. I am a product of Hint MD. I have my Citrus Club. I have 500 members already enrolled in about 6 months. I know that by next year, when we're in New Orleans doing this show on the same Wednesday before the aesthetic meeting, that the majority of doctors will be a part of that Hint MD, the dynamic subscription aesthetic medical services. Patients will buy their aesthetic services on a monthly basis, like you pay for your gym, you pay for your health club, you pay for your Netflix, you pay for your car payment, and on and on. This is the way that Americans are going to buy their aesthetic medical services.
Excellent. There were so many things covered today. I don't know if we can get to them all, but
that's fine.
That's why we'll have one next year, I guess, right?
Yeah, I'm looking forward to next year. I was telling everybody, instead of 300 seats, we need to have 700 seats, maybe 1,000. The word has gone out already. My Insta blew up, my Facebook blew up. People are, hey, I want to go. How come I'm not there? And they've been watching this as we can go. And we've been posting all day long. Excellent. And now we have the biggest meeting of the year for aesthetics, the American Society for Aesthetic Plastic Surgery. It's starting right here in New York. We're starting with our board meetings tomorrow, and we start with hot topics. And I'm sure the buzz will be about AIS, the Aesthetics Innovation Summit.
Excellent. Well, we couldn't have done it without your leadership as well as your co-chairs, Mark Foley and Josh Macauer. So thank you very much.
Thank you very much for having me. I look forward to next year.